You woke up 3 months ago with a vague discomfort in your upper abdomen. Nothing dramatic, nothing that made you rush to the emergency room, just a persistent dull ache that came and went. You took an antacid, you changed your diet, you told yourself it was probably just indigestion, maybe something you ate, or perhaps just another part of getting older. And for 3 months, while you dismissed that symptom as nothing important, something deadly may have been growing silently in one of the most hidden organs in your body. An organ tucked so deep behind your stomach and intestines that by the time it announces its presence with unmistakable symptoms, the window for effective treatment has often already closed. I'm talking about your pancreas, and I'm talking about pancreatic cancer, the disease that oncologists call the silent killer because 80% of cases aren't diagnosed until the cancer has already spread beyond the pancreas to other organs. At that stage, the 5-year survival rate drops to just 3%. 3%. But here's what keeps me up at night as a physician. There are early symptoms, subtle warning signs that appear months before the cancer becomes obvious. Signs that are so easy to dismiss as normal aging, as stress, as digestive issues, that most people never mention them to their doctor until it's too late. My name is Dr. Scott Franklin, and over the past 2 decades working with patients in their 60s, 70s, and 80s, I've seen pancreatic cancer steal lives that could have been saved if the symptoms had been recognized just a few months earlier. A comprehensive study published in the British Journal of Cancer analyzed over 8,000 patients diagnosed with pancreatic cancer. The researchers found that nearly 40% of these patients had visited their primary care doctor with vague symptoms in the 6 months before diagnosis, but those symptoms were attributed to other causes: digestive issues, stress, aging, gallbladder problems, anything but cancer. 40%. That means 4 out of 10 people with pancreatic cancer tried to get help, and the warning signs were missed. So in the next 24 minutes, I'm going to walk you through 8 early symptoms of pancreatic cancer that appear most commonly in people over 65. I'm going to explain exactly why each symptom happens, what it feels like in real life, and most importantly, what pattern of symptoms should send you to your doctor immediately, not next month, not when it gets worse, but now. But right now, before we go any further, I need to know who I'm talking to. Drop a comment below and tell me, have you experienced unexplained weight loss, upper abdominal discomfort, or new-onset diabetes after age 60? Just yes or no. Your answer is going to help me understand how many people are dealing with these warning signs right now. Let me give you critical context before we dive into the symptom list, because understanding what pancreatic cancer is and why it's so dangerous is going to make everything else make perfect sense. Your pancreas is about 6 inches long, sits deep in your upper abdomen behind your stomach, and has 2 primary jobs. First, it produces digestive enzymes that break down the food you eat. Second, it produces hormones like insulin that regulate your blood sugar. When cancer develops in the pancreas, it usually starts in the cells that line the ducts carrying digestive enzymes. These are called ductal adenocarcinomas, and they account for about 95% of pancreatic cancers. Here's why this cancer is so deadly. The pancreas has no pain receptors in its interior. A tumor can grow for months, even years, without causing any pain. By the time the tumor gets large enough to press on surrounding structures, nerves, bile ducts, blood vessels, it's often already advanced. Second, the pancreas is surrounded by major blood vessels and critical structures. The superior mesenteric artery, the portal vein, the bile duct, all run right next to or through the pancreas. If cancer invades these structures, surgery becomes impossible. Third, pancreatic cancer is biologically aggressive. It spreads early. It metastasizes to the liver, lungs, and peritoneum, the lining of your abdominal cavity, often before it causes obvious symptoms. And fourth, there's no effective screening test for pancreatic cancer in average-risk individuals, no equivalent to a mammogram for breast cancer or a colonoscopy for colon cancer. By the time it shows up on standard imaging, it's often too late for curative treatment. But, and this is critical, pancreatic cancer does send signals. Your body does try to warn you. The problem is that these signals are subtle, vague, and easily mistaken for a dozen other common conditions. Now here's what changes after age 65 that makes you more vulnerable. Pancreatic cancer risk increases dramatically with age. The average age at diagnosis is 70. If you're under 50, pancreatic cancer is rare. If you're over 65, your risk is substantially higher, particularly if you have other risk factors like smoking, diabetes, chronic pancreatitis, or a family history of the disease. The framework I want you to carry into this discussion is simple: vague symptoms that persist or worsen over weeks to months, particularly if you have multiple symptoms from this list, deserve immediate evaluation, not watchful waiting, not let's see if it gets better. Immediate evaluation. That mindset could be the difference between catching this cancer when surgery is still possible and catching it when nothing can be done. Now, before we get into the first symptom, do me a favor. Tell me your name and where you're watching from. I read every single comment and I genuinely want to know who I'm helping today. Let's start with the symptom that appears first in about 70% of pancreatic cancer cases, but is dismissed most often as something benign: abdominal pain. But this isn't typical stomach pain. It's not the sharp burning pain of an ulcer. It's not the cramping pain of food poisoning. This is a deep, gnawing, persistent ache located in your upper abdomen, right below your rib cage in the center, or slightly to the left. And here's the detail that matters most. The pain often radiates straight through to your mid-back. You feel it in your abdomen and you feel it in your back at the same time, as if something is pressing outward from inside your body. Why does this happen? As a pancreatic tumor grows, it begins pressing on the network of nerves that run behind the pancreas, called the celiac plexus. These nerves carry pain signals from your abdomen to your spine. When they're compressed or invaded by cancer, you feel pain both in front and in back. Here's the pattern most people experience. The pain is worse after eating, particularly after fatty meals, because your pancreas has to work harder to produce digestive enzymes when you eat. If there's a tumor blocking those enzyme ducts, pressure builds and pain intensifies. The pain is also often worse at night when you lie flat. Sitting up or leaning forward provides some relief because it takes pressure off the area. A study published in the Journal of Clinical Oncology found that among patients ultimately diagnosed with pancreatic cancer, 80% had experienced intermittent abdominal or back pain for an average of 4 months before diagnosis, but most had attributed it to muscle strain, arthritis, or indigestion. 4 months. That's 4 months of warning signals that were missed. Here's what I need you to understand. If you are over 65 and you develop new, persistent upper abdominal pain that radiates to your back, that worsens after eating, and that is not clearly explained by something else like a known ulcer or gallstones, you need imaging of your pancreas. Specifically, a CT scan of your abdomen with 4 contrast or an MRI. Don't let your doctor dismiss this as gastritis or reflux without imaging. Insist on visualization of the pancreas. Here's what you say: I have persistent upper abdominal pain radiating to my back that worsens after meals. I need a CT scan of my abdomen to evaluate my pancreas for structural abnormalities. That specific language gets you taken seriously. If you're still with me, and this is already clarifying symptoms you might have dismissed, take 2 seconds and type the number 2 inches in the comments. It lets me know you're engaged. Let's keep going. Here's a symptom that sounds like it should be obvious, but here's why it gets missed. People over 65 often lose weight for many reasons: reduced appetite, dental problems, medication side effects, depression. So when weight loss happens, it's rarely the first thing that triggers alarm. But weight loss from pancreatic cancer has a specific character that's different from normal age-related changes. First, it's significant. We're not talking about losing 3 or 4 pounds over 6 months. We're talking about losing 10, 15, even 20 pounds over 2 to 3 months without any conscious effort to diet or increase activity. Second, it happens despite eating normally, or at least trying to eat normally. You're not restricting calories, you're not skipping meals, the weight is just falling off. Why does this happen? 2 reasons. First, when a tumor grows in the pancreas, it often blocks the ducts that carry digestive enzymes to your small intestine. Without those enzymes, your body can't properly break down and absorb fats and proteins from food. You're eating, but you're not absorbing the nutrients. The result is malabsorption and weight loss. Second, cancer itself is a hypermetabolic state. The tumor consumes enormous amounts of energy. Your body's metabolism is ramped up trying to fight the cancer, even though you don't know it's there yet. You're burning more calories than you're taking in, and weight drops rapidly. Here's the associated symptom that often accompanies this weight loss: changes in your stool. Specifically, stools that are pale, greasy, float in the toilet, and smell unusually foul. This is called steatorrhea, and it's a direct result of fat malabsorption caused by blocked pancreatic enzyme ducts. If you're losing weight rapidly and your stools have changed in this specific way, that combination is a red flag for pancreatic disease. A landmark study in the American Journal of Gastroenterology found that unexplained weight loss of more than 5% of body weight over 6 months, particularly when combined with any other symptom on this list, had a positive predictive value of 25% for pancreatic cancer in patients over 60. 1 in 4. Those are odds you cannot ignore. Here's the pattern that should send you to the doctor immediately. You've lost more than 10 pounds in 2 months without trying. Your appetite may be reduced, but not dramatically. And you've noticed your stools are different, lighter in color, greasier, harder to flush. That triad, weight loss, reduced appetite, and stool changes, demands evaluation. Here's what you say to your doctor. I've lost X pounds in X weeks without dieting, and I'm experiencing steatorrhea. I need imaging and pancreatic enzyme function testing to rule out pancreatic pathology. Don't accept you're just aging, or maybe you're more active. Demand investigation. This is the symptom that shocks most people, because diabetes is so common after 60 that nobody thinks of it as a cancer warning sign. But here's what research has revealed in the past decade. New-onset diabetes in someone over 60 can be the first manifestation of pancreatic cancer. Your pancreas produces insulin. When a tumor develops in the pancreas, it can destroy the insulin-producing cells or interfere with insulin secretion. The result is diabetes that appears suddenly, seemingly out of nowhere. Here's the critical distinction. This isn't the gradual development of type 2 diabetes that happens over years due to weight gain and insulin resistance. This is diabetes that appears abruptly, often in someone who's not overweight, who doesn't have a family history, and who has never had blood sugar problems before. A groundbreaking study published in the journal Gastroenterology followed over 2,000 patients who developed diabetes after age 50. Among those who were diagnosed with diabetes and then diagnosed with pancreatic cancer within 3 years, nearly 40% had their diabetes appear within 6 months of the cancer diagnosis. Think about that timeline. The diabetes appeared first, as an early warning signal, months before the cancer became obvious. Here's the other pattern. If you've had well-controlled diabetes for years, and suddenly, without any change in your diet, activity, or medications, your blood sugar becomes difficult to control, that sudden loss of control can also indicate pancreatic cancer. Why? Because the growing tumor is progressively destroying more of your pancreas's ability to produce insulin, and your previously stable diabetes is now spiraling despite your best efforts. Here's the symptom cluster that should raise immediate concern. You're over 60. You develop diabetes for the first time, or your previously stable diabetes suddenly worsens, and you have one or more other symptoms on this list: weight loss, abdominal pain, changes in stool. That combination is not coincidence, that's a pattern. Research from the Mayo Clinic found that adults over 50 who develop new-onset diabetes should be considered for pancreatic cancer screening, particularly if they have any of the following: weight loss, family history of pancreatic cancer, or smoking history. Here's what you say to your doctor. I've developed new-onset diabetes at age X with concurrent weight loss and abdominal symptoms. I need imaging of my pancreas to rule out malignancy as a secondary cause of my diabetes. That statement tells your doctor you understand the connection and you're not going to accept a simple prescription for metformin without further investigation. Now, before I show you the next symptom, if this information is connecting dots you didn't know were related, hit that like button. It helps this message reach more people who need to hear it. And tell me in the comments, have you or anyone you know developed sudden diabetes after 60? I want to understand how common this pattern is. Here's the symptom that finally gets people to the doctor, but by the time jaundice appears, pancreatic cancer is often advanced. I'm including it on this list not because it's early, but because I need you to understand that jaundice is never something to wait and see about. It demands immediate evaluation. Jaundice happens when something blocks the flow of bile from your liver through the bile duct into your intestines. The pancreas sits right next to the bile duct. When a tumor in the head of the pancreas grows large enough, it compresses or invades the bile duct, blocking bile flow. Bile contains bilirubin, a yellow pigment. When bile can't drain properly, bilirubin backs up into your bloodstream, and your skin and the whites of your eyes turn yellow. Here's how you notice it. You look in the mirror one morning, and the whites of your eyes look yellow instead of white. Or someone says to you, "Are you feeling okay?" You look a little yellow. Along with the yellowing, you'll notice two other things. Your urine becomes dark, almost tea-colored or cola-colored, because excess bilirubin is being excreted through your kidneys. And your stools become very pale, almost clay-colored, because bile is what gives stool its normal brown color. No bile reaching the intestines means pale stools. You'll also experience intense, unrelenting itching all over your body. This happens because bile salts accumulate in your skin, triggering the itch reflex. People scratch themselves raw trying to find relief. Jaundice from pancreatic cancer is painless jaundice. That's the distinguishing feature. If you have jaundice plus severe abdominal pain, that's more likely gallstones or acute hepatitis. If you have jaundice with minimal or no pain, pancreatic cancer moves to the top of the differential diagnosis. A study in the Annals of Oncology found that among patients presenting with painless jaundice after age 60, pancreatic cancer was the cause in 60% of cases. 60%, that's the majority. Here's the critical point. If you develop jaundice, you need imaging within 48 hours, not next week, not when you can get an appointment, immediately. Here's what you do. If you notice yellowing of your skin or eyes, dark urine, and pale stools, you go to the emergency room. You do not wait for an appointment with your primary care doctor. You say, I have new-onset jaundice with dark urine and pale stools. I need urgent imaging of my liver and pancreas to identify the source of biliary obstruction. Jaundice is a medical emergency. Treat it like one. Let's talk about a symptom that's incredibly vague and easy to dismiss: loss of appetite and early satiety. The feeling of being full after eating just a small amount of food. You sit down to a meal that you normally enjoy, you take a few bites, and suddenly you feel full. Not satisfied. Full. Almost uncomfortably so, as if you've eaten a huge meal when you've barely touched your plate. Or you simply have no interest in food at all. Nothing sounds good. You're not hungry. You eat because you know you should, but there's no pleasure in it. Why does this happen with pancreatic cancer? Several reasons. First, as a tumor grows, it can press on the stomach or duodenum, the first part of your small intestine, creating a mechanical obstruction that makes you feel full prematurely. Second, cancer releases chemicals called cytokines that affect your brain's appetite center, suppressing hunger signals and triggering early satiety. Third, if your pancreas isn't producing enough digestive enzymes due to duct blockage, eating becomes uncomfortable. Food sits heavy in your stomach, you feel bloated. You associate eating with discomfort, and your appetite diminishes. Here's the pattern I see most often. Someone who has always enjoyed food, who has always had a healthy appetite, suddenly starts picking at meals. Family members notice. They say, "You're not eating, what's wrong?" And the person responds, "I don't know, I'm just not hungry, nothing tastes good anymore." This symptom rarely appears alone. It's almost always accompanied by weight loss, because if you're not eating much, and you're not absorbing what you do eat, weight drops rapidly. A study published in Cancer Epidemiology, Biomarkers and Prevention found that loss of appetite combined with weight loss was reported by 65% of pancreatic cancer patients in the 6 months before diagnosis. 65%, nearly 2/3. Here's what should concern you. You've lost interest in food over the past month or two. You feel full after eating much less than you used to. And you've lost weight, even modest weight loss of 5 to 10 pounds. That triad, especially in someone over 65, warrants investigation. Here's what you say to your doctor. I've experienced progressive loss of appetite with early satiety and unintentional weight loss over the past X weeks. I need upper GI imaging and evaluation for possible gastric or pancreatic pathology. That phrasing covers both stomach and pancreatic causes and ensures you get appropriate workup. Nausea and vomiting are such common non-specific symptoms that most people treat them at home with over-the-counter medications and never think twice. But when nausea becomes persistent, when it's worse after eating, particularly after fatty meals, and when it's accompanied by other symptoms on this list, it moves from benign nuisance to potential warning sign. Here's why pancreatic cancer causes nausea. Your pancreas produces lipase, the enzyme that breaks down fats. When a tumor blocks the pancreatic ducts, lipase can't reach your intestines. Undigested fats sit in your digestive tract, causing nausea, bloating, and sometimes vomiting. The second mechanism is direct obstruction. If a tumor in the head of the pancreas grows large enough, it can compress the duodenum, creating what's called gastric outlet obstruction. Food can't pass from your stomach into your intestines normally, so it backs up, triggering nausea and vomiting. Here's the specific pattern. You eat a meal, especially one with any fat content, and within 30 minutes to an hour, you feel nauseated. Sometimes you vomit. Sometimes you just feel sick for hours. You start avoiding fatty foods entirely because you've learned they make you feel terrible. This is different from acid reflux or GERD, where you have heartburn and regurgitation. This is true nausea, often without significant heartburn. Here's the associated symptom: The vomiting itself may contain undigested food from hours earlier, suggesting that food is not moving through your digestive system properly. If you're experiencing persistent nausea, particularly after meals, combined with weight loss, changes in appetite, or abdominal discomfort, that cluster of symptoms needs investigation. Here's what you say to your doctor. I'm experiencing persistent postprandial nausea and vomiting, particularly after fatty foods, with concurrent weight loss. I need imaging to evaluate for pancreatic insufficiency or obstruction. Postprandial means after eating. Using medical terminology shows you're serious and knowledgeable. Indigestion and heartburn are so common after 60 that most people have antacids in their medicine cabinet at all times. You take a Tums or a proton pump inhibitor like omeprazole, and the symptoms improve. No big deal. But here's when indigestion becomes a warning sign. When it appears suddenly in someone who's never had significant heartburn before, when it doesn't respond to typical treatments, and when it's accompanied by other symptoms. Pancreatic cancer can cause what feels like indigestion through several mechanisms. The tumor can press on the stomach or duodenum. It can disrupt normal digestive enzyme flow. It can cause bile duct obstruction that affects fat digestion. The result is a feeling of fullness, bloating, discomfort in the upper abdomen that mimics heartburn or acid reflux. Here's the distinguishing feature. True acid reflux usually responds at least partially to antisabbers or proton pump inhibitors. If you're taking these medications and getting absolutely no relief, or if the symptoms keep getting worse despite treatment, the problem isn't acid, it's something else. A study in the British Journal of General Practice found that new-onset dyspepsia, medical term for indigestion, in patients over 55, was associated with pancreatic cancer in about 1% of cases, but that percentage jumped to nearly 10% when dyspepsia was combined with weight loss or jaundice. Here's the pattern. You develop persistent upper abdominal discomfort that feels like indigestion. You try antacids, acid reducers, dietary changes, nothing helps. The discomfort persists or worsens, and you have at least one other symptom, weight loss, appetite changes, stool changes, that warrants endoscopy and imaging, not more antacid trials. Here's what you say to your doctor. I have new-onset dyspepsia, unresponsive to proton pump inhibitor therapy, with associated weight loss. I need upper endoscopy and cross-sectional imaging to rule out structural pathology, including pancreatic malignancy. That language makes clear you understand this isn't simple heartburn. Here's the final symptom, and it's one that very few people know about, but it's critically important. Some cancers, particularly pancreatic cancer, cause your blood to become hypercoagulable, meaning it clots too easily. This phenomenon is called Trosso syndrome, named after the physician who first described it in the 1860s. Ironically, shortly before he himself died of pancreatic cancer. What this looks like in real life, you develop a blood clot, usually a deep vein thrombosis (DVT) in your leg, with swelling, pain, warmth, and redness. Or you develop a pulmonary embolism, a clot in your lungs, causing sudden shortness of breath and chest pain. These clots appear without the usual risk factors. You haven't had surgery. You haven't been on a long flight. You're not immobile. The clot seems to come out of nowhere. Or you develop multiple clots in unusual locations. Migratory thrombophlebitis, where you get clots in different superficial veins that appear, resolve, and then appear somewhere else. Why does pancreatic cancer cause this? The tumor releases substances called tissue factors and mucins that activate your clotting cascade, making your blood stickier and more prone to forming clots. Research published in the Journal of Thrombosis and Hemostasis found that up to 25% of patients with pancreatic cancer will develop a blood clot at some point during their illness. And in about 10% of cases, the clot is the first symptom that leads to cancer diagnosis. Here's the critical pattern. You develop an unprovoked blood clot, meaning there's no obvious reason for it. You're over 60, and you have vague symptoms like weight loss, abdominal discomfort, or digestive changes that you've been dismissing. That combination should prompt cancer screening, including imaging of the pancreas. Here's what you say to your doctor. I've developed an unprovoked deep vein thrombosis with concurrent unexplained weight loss and abdominal symptoms. I need age-appropriate malignancy screening, including imaging of my abdomen and pancreas. This tells your doctor you understand that unprovoked clots in the context of other symptoms are not random bad luck. They're a pattern. If you're finding this valuable and maybe frightening but necessary, drop a comment telling me which of these symptoms you've experienced and whether you've had them evaluated. Your story might save someone else's life. Here's what I need you to take away from this entire video. Pancreatic cancer is deadly, but it is not completely silent. It sends warning signals. The tragedy is that these signals are vague, easily dismissed, and often attributed to normal aging or benign conditions. Your job, your responsibility to yourself and to the people who love you, is to recognize patterns. One vague symptom in isolation might be nothing, but 2, 3, or 4 symptoms from this list appearing together over a period of weeks to months is a pattern that demands investigation. Let me give you a clear action plan. If you have one symptom from this list, monitor it, track it. If it persists for more than 2 to 3 weeks or worsens, see your doctor. If you have 2 or more symptoms from this list, see your doctor within 1 week. Do not wait. Do not convince yourself it's nothing. If you have 3 or more symptoms, particularly if they include weight loss, jaundice, or new-onset diabetes, this is urgent. You need imaging within days, not weeks. The tests you need to request specifically. 1. CA19-9 blood test. This is a tumor marker that's often elevated in pancreatic cancer. It's not perfect. It can be elevated in other conditions and normal even with cancer, but it's part of the workup. 2. CT scan of the abdomen and pelvis with 4 contrast. This is the gold standard initial imaging test for visualizing the pancreas. 3. If CT is inconclusive but suspicion remains high, an MRI with MRCP, magnetic resonance cholangiopancreatography. This provides even more detailed images of the pancreas and bile ducts. 4. Endoscopic ultrasound EUS. This is where a gastroenterologist passes a scope down your throat into your stomach and uses ultrasound to get detailed images of the pancreas from inside your body. It's the most sensitive test and allows for biopsy if a mass is seen. Here's the conversation script you need with your doctor. I'm experiencing, list your specific symptoms. These symptoms have been present for time frame and are worsening. I'm concerned about pancreatic pathology. I need a CT scan of my abdomen with 4 contrast, a CA19-9 level, and referral to gastroenterology for possible endoscopic ultrasound if initial imaging is concerning. Be specific, be assertive. Do not let your doctor dismiss this as acid reflux, stress, or aging without appropriate imaging. And here's the hard truth. If your doctor refuses to order imaging or tells you to wait and see, you find another doctor. Immediately. Your life may depend on it. Now let me address the fear I know many of you are feeling right now. You're thinking, I have some of these symptoms. Does that mean I have pancreatic cancer? No. Most people with these symptoms do not have pancreatic cancer. Abdominal pain is common. Weight loss happens for many reasons. Diabetes is epidemic. But some people with these symptoms do have pancreatic cancer. And the only way to know is to get evaluated. The point of this video is not to terrify you. It's to empower you with knowledge so that if you are in that small percentage of people who have early pancreatic cancer, you catch it while treatment is still possible. Early stage pancreatic cancer, when it's still confined to the pancreas and surgery is an option, has a 5-year survival rate of about 40%. That's not great, but it's infinitely better than the 3% survival rate of advanced disease. That difference, 40% versus 3%, is determined entirely by how early the cancer is caught. And how early it's caught depends on you recognizing symptoms and demanding evaluation. Before we wrap up, I want to talk about risk factors, because if you have certain risk factors, these symptoms should concern you even more. You are at higher risk for pancreatic cancer if you smoke or have a significant smoking history, have chronic pancreatitis, have long-standing diabetes, particularly if it's poorly controlled, have a family history of pancreatic cancer, especially in a first-degree relative, carry certain genetic mutations like BRCA2, which is associated with both breast and pancreatic cancer, are significantly overweight or obese, are over 60, which is when risk rises sharply. If you have any of these risk factors and you develop symptoms from this list, your threshold for seeking evaluation should be even lower. Now I need you to do something for me. Drop a comment right now and tell me, are you going to talk to your doctor about symptoms you've been ignoring? What's holding you back from getting evaluated? I read every comment. Sometimes people just need permission to take their symptoms seriously. Consider this, that permission. If this video gave you information that could genuinely save your life or the life of someone you love, hit that like button. Share this with your family members over 60. Share it with friends who've been complaining of vague digestive symptoms. This information needs to reach the people who need it most. And subscribe to this channel right now, because next week I'm covering the 5 foods that increase pancreatic cancer risk after 60 and what to eat instead. Prevention matters just as much as early detection. You'll want to catch that one. Until then, trust your instincts, listen to your body, advocate for yourself, Don't let anyone, including your doctor, dismiss symptoms that concern you. Your life is too valuable. Your time with the people you love is too precious. Don't gamble with either by ignoring warning signs. I'm Dr. Scott Franklin. I'll see you in the next one.